Well, what's motivating me is I'd like to get back to my old job and as close to the old me as possible. And I'm a dog trainer by trade. Um, and the reason I want my elbow working.
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
While I'm doing this, I'm getting the last couple of things set up here. Would you mind just give me a quick introduction to who you are and where you calling from?
My name's Darren Mormon, and I'm calling from Freeland, Michigan.
Okay, all righty. Michigan.
Yeah, it's kind of a nasty day up here today.
Oh yeah.
Yeah.
Well, why is that?
Yeah, rainy, about 45 degrees and windy.
Ah, well, come February, you'll be hoping for 45 and rainy, I guess, right?
Yep.
Well, good. It's good to have you here with me today. So with that being said, what can I do to be helpful for you today? And any questions, comments, or would you like to go through an assessment? I really like to let you guys drive the ship and I can just be a resource for you.
I really, I don't have any questions. I mean,
Okay.
I have the Motus hand, as you know. I mean, and it's been been working well. I mean, my therapists have noticed how easy my hand is to move
Okay.
lately, but I have not noticed improvement in my ability to my wrist up, and but I've noticed that I'm getting stronger on my grip and
Good.
everything.
Okay. Stronger than good. Okay. And Darren, you'll forgive me here, but I'm just taking some notes so that when we work together in the future, I'll be able to remember kind of where our baseline was. So give me some insight into when you had your neurologic injury.
Well, it was April of 2016. I had a major stroke because of an aneurysm I had in my head, above my left eye. It was like 40 millimeters. Yeah, it was huge.
Yeah, quite large. Yeah, 4 centimeter aneurysm is
40
substantial.
centimeters.
40
millimeters.
millimeters. Yeah. 4 centimeters is substantial. So, well, good. I'm glad you're here. And with respect to your rehab since then, so 2016, so out past 5 years, that's great. Tell me about your rehab experience so far. I presume you did kind of the inpatient rigmarole and then went probably through outpatient as well. So tell me a little bit about that.
Well, PT has went well. I mean,
Okay.
I'm getting a benefit out of that, but
Good.
OT, not so much. I mean,
Okay.
I spent 6 weeks in a hospital inpatient and at University of Michigan. After that, I've been in therapy forever, it seems like. OT hasn't made much progress on me.
Okay. Why do you, if you were to take a stab at understanding why that's the case, can you give me some insight as to why you think that's the case?
Well, we have different, different things that are priorities. I mean, while they're focusing primarily on my hands, and I'm focusing on my elbow and everything else. The Motus hand does everything that OTs do for me now. I mean, it pretty much duplicates the OT work, which I'm trying it, and
Sure.
I'm sorry if I'm a little choppy on my speech, but
No, Darren, it's totally fine. I'm giving you the chance to transmit. I very much have been in the same boat as you. When I had my brain injury, I had to go through speech and all of that, and so I'm very receptive to the sort of time it takes to process and or to get a message out. So don't feel like you have to rush here, and I'm not. There's no pressure. So just do your best.
okay. It's well, I could if I could move my elbow, I consider all the therapy that we do a success, but I just can't at this point. But I'm I like to work. I like to work outside, and I do that a lot. I mean, in fact, the days I missed on the Motus were due to my outside work. I mean,
Okay.
just
We'll call that functional rehab.
Yeah.
I'm all for that. So no worries.
Okay.
I want to pick up on something that you mentioned a second ago, and it was a bit subtle potentially, but it meant something to me. And you said something to the effect of, it sounds like our goals between the OT and your own goals were a little bit maybe not in harmony. Would you mind expanding upon that so I understand what's really motivating you?
Well, what's motivating me is I'd like to get back to my old job and as close to the old me as possible. And I'm a dog trainer by trade. And the reason I want my elbow working and not so worried about the hand, I can grip with the hand already. I just can't let go. But I can't move my elbow only but one way. I can curl it up, curls. I mean, the OTs just seem to be focused primarily on the fingers. I mean,
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
So Darren, is that mostly, is it for commands? Is it, what type of dog training is it, by the way?
well, I do obedience training and
Okay.
field training on retrievers.
Okay.
So, obviously I'm not working at the moment, but not because not a call for it, but just because it's too dangerous for me at this point.
Sure.
Because if I get young dogs that try to jump on me, or I'm more stable now than I was, but I'm too unstable to be safe, I guess.
Understood. Okay. Well, that's good. That's I think it's often a good thing to recognize that when it is safe to proceed with something. So that's really good. And when it's not safe to proceed, I think having that insight is helpful as well. But it also seems like it's one of your main motivating factors here. So you very much resonate with that. And so in terms of, so you didn't say you had any questions. That's good. And don't feel like you have to get all your questions out now. We're happy to work together in the future. So if you have questions then, just bring them up then.
Okay.
But in terms of your Motus hand, how was the setup process? Did you have any trouble, or would you like to go over any aspects of the donning procedures, how to put it on, or kind of negotiate it?
I've figured that out
Okay.
all by myself. I can put it on by myself, and I
Perfect.
don't need help to do that. But it works pretty good. It's pretty self-explanatory. The instructions were dead on.
Okay. Good. And I think, is it Greer? I see you have a question here in a second, and I'll be with you in just a moment. Okay. I think Greer, I apologize. I'm not able to hear you right now. I think you're muted.
Yeah, I probably was. Can you hear me now?
I can, yes.
Okay. Sorry for interrupting, but I just had a question about the donning because I need somebody else to help me lift my arm and put it in the Motus to put it on.
Sure. Yeah. Yeah.
And it
Well,
requires another person. It has to be free, and so it could be very difficult.
yeah. I agree. I think that's a good point.
Maybe you or
And
Darren has a one-handed, but I can't really lift I can lift my arm, but I can't really lift my
yeah,
elbow. I'm not as mobile as Darren is.
sure. Well, Greer, I think that this is a really important aspect, and I will address this. And in fact, I have a resource that I'll be sure to send you after this, where I filmed a one-handed donning procedure. So one, I'll go over it with you, and then I'll be sure to send you that resource.
Okay, good. Yeah, because my right side is totally fine, full
Okay.
strength, etc. My left
Good.
side is like a bag of figs.
Sure, a bag of figs. I've never heard that one before, so that's a good description. I'll remember Greer as the bag of figs.
It's a little more genteel than what I really wanted to say.
Sure. No, that's totally fair. No, it's sometimes when those things just catch you by surprise and just give you a big smile. So I appreciate that. Good. Well, so Darren, I think with respect to the Don, that's great that you're having your good success there. And on the ease of use, that sounds good as well. Now, with respect to the settings, the ranges of motion, the assistance levels, all those things, how are you finding the difficulty, and how are the individual activities? Because we can, of course, do an assessment to kind of walk through things and see where you are. But it also depends on kind of where you, what you'd like to do today as well.
Well, I mean, I like it. I just have had it for what I've had it for 2 weeks.
Yeah.
I like everything about it, but except for the hour a day. I mean, I find it difficult to find that much time to sit down and do it.
Okay.
That's true.
Yeah, that's true with everything.
Sure. Well, Darren, I think that is that's totally understandable. Now, it's neuro rehab is not for the faint of heart, and you've been doing this for 5 years now, and you're well aware of that. So I don't have to. I'm preaching to the choir here. And so I think one of the other kind of interesting elements that we can talk about is maybe the fact that you don't have to sit down for 30 minutes a day, for an hour a day. Maybe you parse it out into individual chunks, right? Where maybe it's 30 minutes at a time. And, or maybe it's just the fact that you don't have the hour in a day to manage it. I'm not sure exactly what the rate limiting step is there, but there's some scheduling flexibility that we can sort of utilize to maybe make it a bit more palatable.
I was thinking about doing that.
Yeah,
just starting that.
I'd say that, especially if it's, because there's two things here that are really important. One is the fact that we need to get the dose, right? The dose is really important, but people think that the dose is just, oh, I'm going to slap it on and I'm going to have it move me. And the movements are, of course, what's called necessary, but the movements by themselves are not sufficient. So what I mean by this is that you have to also have other component to the movements. And that's so important. That is the ability to engage in something. And this could be, engagement can be challenged by any number of things, whether it's motivation, whether it's, actual physical, like cognitive difficulties, et cetera, et cetera. We need to be able to accommodate that. And for us to get the most sort of ROI out of a rehab intervention, we need to make sure that you're engaged in it as well. And so what I would actually encourage you to do, if you're finding that an hour is too long for you to just stay motivated, for whatever reason, there's no judgment here. It doesn't matter what it is. We just need to parse it out into the places where you can stay motivated. And if that's 20 minutes at a time, let's start with that. And then maybe do it 2 or 3 times a day instead of doing one full block of an hour. And that could be one strategy. The other thing I might mention is, contingent upon your level, it may be, that level of sort of lack of interest or motivation may be due to the fact that the activities are too easy for you. So I think it might be good to look through and see exactly what types of motion you have, to then determine what types of activities we can do. And that may help you gain access to more sort of enjoyable games, maybe more challenging ones. And so that could be one strategy that we take right then and there.
Okay, that sounds good.
Okay. All right, guys. It was great to meet you. I'm Darren and Kim virtually, and I look forward to seeing you very soon.
Okay.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.